AI is going to be transformative for healthcare. The same way that no one would consider flying a passenger plane without an automatic pilot, I'm convinced that within the next few years, no one will be practicing pathology without the assistance of AI. Pathology is the process through which you take a tissue sample from the human, a biopsy. A pathologist looks at that in a very large magnification and diagnoses disease. Most of what they do is diagnosing cancer. There's a worldwide problem in the practice of pathology. You have, on the one hand, more and more incidents of cancer, and on the other hand, you have less and less physicians entering the practice. So you have this growing gap between the need, the growing incidence of cancer, and the capacity of the labs to actually handle this need. This is where our technology comes in. What we're able to do is take a scanned pathology slide, a high-resolution image, and then our algorithm can analyze it, detect the different tissue types, detect where the cancer is, do the grading, and make a diagnosis in the same way that a pathologist can do. In every lab that we work with, we see diagnostic error. What our algorithm helps to do is simply reduce this error rate by 2 orders of magnitude. The algorithm raises a flag if it thinks there's a high chance of a diagnostic error, giving the pathologist a chance to correct this error. IBEX was the first to deploy an AI solution for routine clinical practice in pathology. We signed a strategic partnership with Maccabi Healthcare Services. They have the largest pathology lab here in Israel. Through our partnership with Maccabi, Israel has become the leading country in the world in the application of AI in cancer diagnosis. A startup is a marathon, not a sprint. You need the right partner. Partners who are willing to join you on this journey, and we found that with Amun.
We invested in IBEX early on. Their first institutional round, their A round, we led that round. We already had the vision, something is going to change in the world of pathology, and IBEX is just the right company, the right team at the right time to drive that change. They built their platform based on unparalleled access to data that includes both pathology records but also the clinical records of the same patient. When you can couple the pathology data together with the clinical data and say something about the future course of the disease and what would be the right treatment, you can really deliver tremendous results. It's really becoming the pathologist's best friend. When you hear pathologists who've been using their tool, they're saying, we don't want to go back. It's not about replacing them, it's about enhancing them. And by that also, of course, providing much better care for patients.
We've grown from a single deployment of our system here in Israel to worldwide deployment, academic centers, university hospitals. The largest pathology network in Europe is using our system.
When we ran our due diligence on IBEX, I had a meeting with our chief medical officer, who's also heading the largest pathology lab in Israel. And what she told me was that when the co-founders approached her, she told them, this is impossible. What you guys are trying to achieve here just cannot be done. This is too complex. Pathology has too many features. Find something else to do. Here we are, a few years later on, with a company that is deployed in dozens of locations around the world. It's really unparalleled when you look at the entire universe of AI in pathology.
The patient wants to get the right diagnosis quickly and to be confident that they're put on the right course of treatment. IBEX addresses all 3 of these problems. Our technology serves as an equalizer, which allows delivering better quality healthcare, regardless of where they are, to everyone.